Impact Health Gambia, a Minnesota-based non-profit, has donated a consignment of essential supplies to support patients at Tanka Psychiatric Hospital, the country's only inpatient mental health facility. The contributions made possible through the group's network of donors and partner institutions in the United States were handed over Friday at the Edward Francis Small Teaching Hospital in Banjul for delivery to Tanka. The donation includes hygiene and feminine products, clothing, blankets, items officials say will help improve the quality of care for some of the nation's most vulnerable patients. Abdul Wahab Manjang, founder and chief executive of Impact Health Gambia, said the initiative stemmed from a concept developed last year to address the unmet needs of psychiatric patients. He expressed appreciation to the Gambians who helped organize outreach efforts and mobilize support for the cause.
So a year ago, I believe, we came up with this idea through the goodwill outreach by our sister Sire and Ule Jao to see how we can support patients at the psychiatric hospital, the Tanka Psychiatric Hospital. And through that collaboration, we came up with the idea, how about we do some little fundraising, see what are the needed supplies that we can get for them. And because of that, we raised a decent size amount of dollars, and we purchased some hygiene supplies, feminine supplies, deodorants, and all those other things, and get some blankets for them as well, and clothing for them to use. So we are here today to present that. I would like to express our gratitude to our sisters in the Gambia here who felt this is a need and then did an outreach, but also all our donors, those who contributed $1, $5, $10, and shipment to ship these supplies here. So we are grateful for your support, and we're looking forward to expanding this.
Keba Sane, Principal Public Relations Officer at EFSTH, thanked the organization for what he described as a timely intervention, noting that the items will have an immediate impact as the country moves into the dry and dusty Harmattan season. He added that mental health facilities such as Tanka are often overlooked, and he commended the non-profit for extending support from abroad.
We must say that this is something that we would hope that other organizations, Gambian-related organizations in the United States, will emulate the Gambian Association of Nurses in Minnesota, look at this country as one of these places where help is highly needed, and coming into that to help is always and will always be appreciated. So on behalf of the board of directors of this institution, the management of this hospital, and the entire staff, we thank you very much for thinking of us, and we hope that this will be a continuous thing. Collaboration between Gambians abroad and their organizations with the institutions on the ground.
Binta Sane, the principal supply officer at EFSTH, echoed the praise, saying the donation carried significant meaning for the hospital. She added that it was heartening to know that Impact Health Gambia had considered their needs.
These items might look small in your eyes, but they are great. They are big items in our eyes. Because the fact that you sat down and come up with this initiative, it shows your love, how you love our brothers and sisters over there. And it shows how you are concerned about us. So we are grateful. We thank you all for this kind gesture.
The contribution to Tanka comes on the heels of other recent interventions by the organization. Earlier in the month, Impact Health Gambia provided essential supplies and a free pediatric surgical screening at Edward Francis Small Teaching Hospital and donated critical medical supplies to Manduri Clinic. Reporting for Kerfatu, I am Makutumani.